There we go. Okay. Una kushe una kabo. Una welcome to the WBBPG Gentry program. When I salon people don't learn boku book, and they bring this program to una. Me not to one for them. Me in a business IT consultant. My only responsibility now and for make sure see them people are they bring this show to una in a way we go be uninterrupted for giving the IT support basically now therefore. And also for be the host for talk boku. But the one way they do the program, these are doctors that we don't learn and they specialized in various areas within medicine. And we also get doctors them nurses them as well within the group. Today at the 81 session, the 81st session, and today we deal with cancer awareness. Today is Sunday, the 8th of December 2024, and I Dr. Christian Bell. Don't worry about the other name then at the middle. He will explain all the name then later, but Dr. Christian Bell, and they present to it today, and Dr. Mohamed Z. Turay, and they present to it today. They are two combined for present to we will then go look at things from different perspectives, but then we explain how they good woman, which perspective they go for the look at. My name, that's John Fuller, and when I get the WBBPG Gentry team, where we talk about say various doctors them and nurses. We don't practice, don't study and practice the medical medicine across various specialties. And not to the all based safe in England, and based different places in the world. Some man even study back home. So we for be proud to say we get people and we don't reach this level where they able to bring this program to now. And give me family them. This program will the bank and to now. Absolutely nobody get paid a single penny. Okay, we do them no more because we let people them. And now we on way this way we see say we for able pass good messages to people. So dear, if anybody we continue for appeal. If anybody gets away for this program, reach with people then back home, whether you can share the recorded version or whether you get access to radio or TV where you want to present, I will never for charge you anything. We will give to you for free and you free for publishing and for the people and able benefit. Okay. So like how they say, a group of professionals them we don't study book across the world. We try for bring this program to all Sierra Leoneans. And when I say Sierra Leone community, not just UK, across the world. And I make we can share this thing in any WhatsApp forum for the other people and benefit. And like I say, we know they get paid, we only try for do them for little benefit to people. And we do them in Krio for them be easier for people to understand. When they say people don't understand English, or no. But sometimes they wait done before doctor, where they don't tell you bad news, sometimes they you not know waiting for do. But if we don't tell you waiting for do in your mother language, it's easier for you understand, waiting for ask where you go see a doctor, when for go see a doctor, and how you for able to manage certain, ailments where go meet you. I make we do them in Krio for people that you benefit. All right. Like what I say before, the recorded version will be on social media, YouTube, Facebook, and we also get a WhatsApp group where if you wish, I will share the link. If you wish, you can join. And we know the police in a way for say who that will join or they join. No, we'll share the link and let you join. If you feel say, feel for the day again, it's up to you as well for remove yourself. Not only they remove, you can remove yourself. And also, like I say, we share the link for let you join. However, please, this is not festive period. So be very, very mindful of fraud. We don't get few cases where people in the contact people and they say WhatsApp, we get WhatsApp meeting, WhatsApp or Zoom meeting and whatever like that. No. When we get meetings, like only kind of meeting, how they get to people and we'll get time we bring out a flyer, we go put another group there or we'll publish them in other forms where we can normally do. So do ya not send code to anybody. We know they ask you for send no code. Anybody contact you, challenge the person. Call somebody who is sabi within this WBBPG Gentry team and ask just for verify. Okay? But please do not send code to anybody. Okay? If you see do that, then go most likely hack your device. Okay. While we do the program, I'll go for mute everybody and for let the person able where they present to not uninterrupted. But at any point in time, at the end, when the person not present done, or today we get two people they present, when they don't done, we will go that time for ask questions. And for ask question, normally most of our device and so on, I go see them. So if you look like this bottom now, you get 3 dots. If you click on that 3 dots there, you will see this thing appear. You can use the chat for ask question. If you know what is your hand up or you know what show your face, you can use the chat. Just like I did, you use WhatsApp or Facebook, you can use that for chat to me. But if you feel say you're bold enough, like me, for example, or your environment good for you, because the other thing is that your environment, if you don't see your environment not good for public viewing, you are the big. No, not show your camera because something we might not see wetin dey happen. And ways we don't record them. If I not go over them again, most likely we'll post them. And if you post them live, somebody go see it enough for see and not go find for we community, not to just the World Body Better Part Gently program. Okay. But if you press this one and it go show me a sign so you hand it up, then I will come to you for ask question. However, if you're able to do all this, that's fine. Just turn your camera on. If you are not physically, when I see you, I will come to you. If I not come to you quick, it not means I ignore you, it just means no more. I they try forget other people and forget or talk about what try for acknowledge you. Okay. I don't talk beaucoup. Like I say, if we do anything we una not like or do something we una like or una feel say certain subject they for cover, please feel free for email we Naya. I will share that there as well in the chat or contact with our WhatsApp number Naya. I will share the link as well to the WhatsApp group. So if you want to join the group, now what we know to the group, they can't put marketing stuff. No, we need to put down the only two the doctors and they put that's something for do medical stuff where they affect with people then. If you not get for do that, we'll not post there, is normal people, everybody else that they post are just the doctors them. So please, I would encourage anybody, if you get a link, please join. Apart from that, I don't talk about cooler and over now to the doctors, then we then take on through the session today. Thank you.
Oh. So, good evening once again. Mina Dr. Christian Bell. Mina OBGYN specialist and my subspecialty na reproductive medicine they do. Today, we topic we will talk about na cancer awareness, na general cancer awareness. And this topic is so that me and Dr. Turay they handle them. My source, or the sources how we get my information are from the WHO. You get two organizations, them where they're under the WHO. You get the International Agency for Research on Cancer, and then you get the Global Cancer Observatory. Now they pull me information where are they given at today. We start with the definition of cancer in general, and then we'll talk about the problem, and then we talk about the different causes of cancer, the risk factors, we talk about the prevention, early detection, possible treatment, and palliative care, and also we give 3 examples them from breast cancer, cervical cancer, prostate cancer, and lung cancer. But as I say, this is not just a general topic on cancer awareness. What's not cancer? Cancer not a name we they use for a large group of disease where they affect all parts of the body. And now the rapid and uncontrollable creation of cells them, of abnormal cells them, we can go beyond the boundary. If you watch this picture, they show you get the one cell, we can change and cell them when I for the look cell like a block then a os. Yeah, we body now like a one os, and then the one block then at the os, where you take for build the os, now we'll call the cell them. So like the one cell now you can change. And when that one cell they change, it begin grow now. It grow then where if it's still there around the side if for day then it's okay. But then if it busts like it busts the boundary, it go into the blood vessels them, then now it go to other parts of the body them and to other organs them, which they call metastasis. So that means one, you get the uncontrollable development of cells them. First, then they inside the same area, but then afterwards now, then they invade other body parts them and other through the blood vessels, for instance, and then they call metastasis. And then the metastasis, where they go to other organs then, are the main primary cause of death from cancer. Then get other name the way they can call them. They can call them malignant tumors. They can also call them neoplasm. And cancer, unfortunately, now one of the leading cause of death worldwide. You therefore also know say this thing has to a multi-stage process. Yeah, that means it can start where it's still the inside in boundary. It can start as a what we call a precancerous lesion. And then we continue for develop, now they turn the malignant tumor. The one thing you have to know is that the way the thing they begin develop, nobody really get pain. Now, after where it don't develop to a certain stage, now make people can begin get pain. So 2022, we get statistics from 2022, we say 20 million new cases of cancer, 9 days in the world. And 9.7 million people then die of cancer. Just imagine 9.7 million people. Salon, we get about 7 million, 8 million people. And you find out, say, one whole year, 2022, the people that will die of cancer, even more than the population of Sierra Leone. Then they now very, very important thing for make people know. A lot of people they die of cancer. And if they think of that, one whole country they be wiped out every year because of cancer. And the amount of people that will live with cancer for the last 5 years is about 53.5 million people. Then. And then say 1 out of 5 people them will develop cancer in their lifetime. Think about almost people in this session at the moment. 1 out of 5 most likely will develop cancer. And then say 1 out of 9 men them and 1 out of 12 women them, then they die of cancer or then die of cancer 2022. And what's not the most common cases of cancer when they fail? Lung cancer, breast cancer, colon and rectum cancer, prostate cancer, and stomach cancer. And then the people that when they die of cancer, the most common causes of death from cancer are lung cancer, and a colleague can call them the fuk. And then you get the colon and rectum, that are the gut area, and they get the liver cancer, you get the breast cancer, and then you get the stomach cancer. Look the amount of people where they die of them thing and they will die of them these different cancer than they 2022. We look with lung cancer, 1.8 million people then die of lung cancer 2022. So per demand then, you get the lung cancer, prostate cancer, and colorectal cancer. And per the woman then, unfortunately, breast cancer, when a one cancer way, theoretically speaking, you can actually avoid. And they get the lung cancer, and then they get the colorectal cancer. So the colorectal cancer by man and woman, and lung cancer by man and woman, the main cause is the back. But unfortunately for the woman side, especially when it comes to the breast cancer and also the prostate cancer, we will talk about that later. And that cancer then the way theoretically speaking, you're able for find quick and you're able for cure early. So by picking them, you get 400,000 picking them. They develop cancer every year. Dr. Nelly Bell been do a session on pediatric oncology. It is on my YouTube channel. If you want to go on our YouTube channel, you will find that session there, and I will encourage each and every person for go there and watch that session there because it's also very, very important for picking them. I mean, thinking about it, 400,000 picking in the die of cancer each year. So, what are the causes of cancer? First, you get the genetic factor. But then it can also be said you get the external agents them, and you get 3 main external agents that will actually they contribute to the creation of cancer. And one are the physical carcinogens. The carcinogens are the thing that will cause cancer. You get the physical, get the chemical, and you get the biological. The physical ion na radiation. You get the ultraviolet radiation, and they get the ionizing radiation. And then when it comes to the chemicals, you get different chemicals that really cause cancer. The one where I get for highlights more, that is smoking. Yeah, smoking and alcohol. You have to get asbestos, then they try for eliminator now. And you get also food contamination and drinking water contamination, they will also cause cancer. When a carcinogen or the agents, they will cause cancer. And then the biological one, then you get to do some viruses, then they cause cancer, you get some bacteria, then where they cause cancer, and you get some parasites, then where they cause cancer. And age also they play a very big role. You get to understand, say that when people they grow older, that repairing mechanisms, you get some kind or a repairing mechanism where they happen in our body. The body they can always some cell and they die, and then they get generate and they repair. And when they get to older, that mechanism they know they function properly. So through that, the cancer cells them, they're able for repair, they able for destroy them, and then they can make you get cancer, make you get cancer at the older age. So what are the risk factors? As we don't talk about the causes, yeah, tobacco use, alcohol consumption or excessive alcohol consumption, unhealthy diet, physical inactivity, air pollution, and also some chronic infections them. Chronic infections them. I will highlight a few of them. Then say 13% of cancer in 2018 been caused by this biological carcinogen. We talk about infections then. And the main infections, the main thing that when they cause the cancer, 14% of cancer in 2018, that be the Helicobacter pylori, where they cause stomach cancer. And then you get the HPV, the human papilloma virus, and a virus where they cause somebody, for instance, cervical cancer. It can cause also cancer other side, and they can cause the throat, but mainly a cervical cancer. It can cause they get hepatitis B and hepatitis C virus. Them we can cause liver cancer, and then you get this Epstein-Barr virus, we can cause lymphoma. That means the cancer that the blood is there. Yeah. We know say 50% of cancer can be prevented if you avoid risk factors then. We don't talk about the risk factors then. So the one main awareness that the way people are supposed to know. Say you for try for avoid the risk factors then they. And if you try for avoid the risk factors, then 50%, your chance for making you get cancer, the 50% lower. Then the one main thing that the way if we not take anything from this session here, so now one of the main things that they will get for take from this session, say if you want for prevent yourself from get cancer, stop for smoke, stop for take excessive alcohol, avoid like of HPV, for avoid forget a lot of sexual partners. Then, for instance, so you get for avoid the risk factors and the for reduce your chance for get cancer. And which we know about is that if you're able for diagnose the cancer early, sometimes you're able for cure them. And not only for diagnose them early, you also get for treat them appropriately. Get the right treatment. Because sometimes you can able for diagnose the cancer, but the treatment not available, or you get the wrong treatment. So firstly, avoid risk factors. Secondly, make sure say you go for checkup regularly for make they either diagnose them early and also able for treat them early. So the prevention you get for stop for smoke, as I say, you get for maintain a healthy body weight, you get for get a healthy diet, including fruits and vegetables. Physical activity is also very important. You therefore avoid and reduce your alcohol consumption. You they get possibility for get vaccine, like for instance, HPV and hepatitis vaccine. Therefore, avoid radiation, and you therefore reduce your exposure to pollution.
So, me family, I mean, Dr. Turay. So this, me a Nigerian physician. So as Dr. Belby they talk, um, when you avoid them things in there, you go able for avoid cancer. However, um, certain program then they will don't put in place, government don't put in place where they help people them for catch the cancer early, even before you begin notice any symptoms. So for catching early, you can do screening program, and also then do diagnosis early. If you get the symptom, you go meet the specialist. So the screening program na a wide na a program normally can set up by government. However, not to thing way easy for set up so, and not to all cancers they be screened for. The aim of the screening basically now for find out the people them where they get the cancer even before they begin get the symptoms. And in some cases, you even prevent the cancer from developing, like for instance, cervical cancer, where and the HPV where Dr. Bell they talk about. When they catch the thing where they cause the cervical cancer, then kill that bug day early, it will stop you from getting the cervical cancer. And some of them you can't stop it, but when you find that early, you will be able to get proper treatment and then go do further test. However, this can come at the expense, from the government. Maybe it get for cost so much money for roll out a cancer screening program. In the UK, the most established cancers they within the screen and mainly breast cancer, um, bowel cancer, and cervical cancer. The other cancers, them they not they into a well-established program yet. The one where they don't try for introduce gradually in a lung cancer, but not to all size of a day. Why they know they do cancer for every and then they do the screening for every cancer now? Because one, they need to make sure say this cancer the benefits where they get from the investigation way they do it outweigh the risk, because sometimes you can get false negative because you can go do the test, it says a cancer no day waste on time a day, then you get false positive, it can tell you say cancer day with cancer no day, then it can lead to a whole range of other things that we go make them do boku investigation, boku treatment we something you not necessarily need, and then they again can lead to overdiagnosis because then they pick up cancer them where they're very harmless. You see, so and when they do then screening thing and this one, it can cause small pain, small bleeding, small discomfort, then thing and they. So now then they actually make note to all cancer in the screen. So the take home message on this one is that the cancer during the screen for, if you belong na then group then they go let them go screen you. If you not belong na then group then they you get symptoms that will get for talk later on, you get for go see you specialist so that they will investigate you early and pick on up early. Now when it comes to early diagnosis, as we say earlier on, some thinking they need to get no symptoms. But if you begin get symptoms, the different cancers and try to know the different type symptoms and what can cause them. The symptoms then in most cases then they overlap with other conditions. But if you find out anything abnormal within yourself, the first thing now for go meet a specialist. Not just go meet anybody, meet a specialist and let them go able for evaluate, then go examine you, then go do proper diagnosis, then they go refer you quickly for let get treatment. Why this necessary? Because the benefit of it is that if you then catch this cancer quickly, like how Dr. Belby talk, where that cells they like that block then at the host. If one block don't begin, they go bad, right? Then catch them quickly, then go able for arrest them, then destroy them. You get better response where they get almost 100% response in some cancers them. And they survive longer. The time for let it go affect you lifestyle go be less, and the treatment side go be less expensive. That's not the benefits where they get. And if you delay, you get the consequences where you no go able for treat early and all the opposite of what we don't talk. You see, so the cancer program they would then put now basically now for diagnose the person first, then treat the person based on waiting and find out. Then if they're able for treat them, then give that support where he will able for get so that he will able get live a better life. The of all the cancers, then you get a general treatment where they can normally do. Now, mostly if the cancer not go far yet, then can do operation for take the cancer out. And then can mix the operation. So if they don't do operation, they can put some radiotherapy when now heavy x-rays then wouldn't they target that bad cancer cell we don't they for damage them. Right? And some thinking then they give you medication them where they take, where they either different route of way they get the medication, either through your mouth, through injection, different way. Then they give them medication they can call chemotherapy for let them go help you. And so they can then hormones then they give we go arrest some of the cancer them. You see. So the aim of the treatment now for, I mean, we don't repeat that most times now for cure the cancer. If they're able for cure the cancer, and they give a treatment where go prolong the life of the person. And if they're not able, then we're able to improve that short time where they improve in life, so that it will able for the mentally, physically, and psychosocially able for be alert, it will able for live a better life, at least in a life stage of life. So for them case the way they know able for do not when I help, then they help you no more. They bring up this new system, this system we then call palliative care. That to say, really, they're not able for do any active treatment for stop the cancer. They already don't they. Right? So what they do now for treat the symptoms them way you they get, where the person get the cancer, the symptoms the way they get, then they treat them symptoms for reducing suffering, for improving quality of life, because if improving quality of life, they get less burden to in family them, right? And they help in family them back for this spiritually and mentally and physically alert back, and it will help the person live a comfortable life, even though there's no chance knocking there for letting cure them. So different way they can do this. Some can use spiritualists or religious leaders people for talk to the person psychologically, prepare a mind, and then they can help 90% of people for let it cope with them. You go say physically, emotionally, in a mind, say yes, there is hope somewhere. And when in addition to that, they can give medication them where they help for treat this the symptoms them. They can give them either through a mouth, or then they put patch in the person in skin, or they can give injection for reduce the symptoms and the way the person they get. The aim of it all now for just control the symptoms them. But this wire not like a one size fits all. Every individual where they into this care get immune treatment we target to them based on in the cancer where the person gets and the stage of and the stage where it don't day. basically. So it day on different individual. They can give pain because most people in the suffer with pain. So now pain and breathlessness, they can give medication and like them morphine medication them for help them thing and they. The other common symptoms that the people in they get now anxiety. They feel agitated, they feel so much anxious and worry, so they can it can feel like say they no side day. Yeah, it feel like delirious, no side day when they talk to an a different thing they talk. They go say they see things or they read things they talk to. I don't know, saying go even for recognize the people themselves where they are around and sometimes. So then they give medication for help then in there. And most people them when they go towards the end of their life, then breathing they become so noisy because they get build up boku bolo bolo them or secretion them na in breathing part in fuk like how Dr. Kamara can call her. So then they give medications them really for reduce them, and when they vomit and feel sick again, they give them medication for that. So I mean in the UK we get different I'm sure in other countries they get different palliative care settings, maybe they do in the community in different centers, but I think na Salone you get the Connaught team when at the palliative care unit where then they deal with that. I think their names of them people are then at the head of the people who they deal with that kind, treat them people in na Connaught, Dr. Thompson, Dr. Bond, and then Nurse Sanko, and Nurse Aminata Kamara. There, I think that then the people in a Connaught where we understand say can deal with them, and if somebody they salon can contact them.
Yeah, so now we come to the different examples them. We now just briefly we talk about them because breast cancer, cervical cancer, and prostate cancer we don't do before extensively. When I can go on the YouTube channel and go watch them. But briefly, for me, when I understand what they try for talk, like for instance, for the breast cancer, we know say if you watch this picture, so you get the normal. Okay, first of all, you get for the breast, you get what we call the duct, and then they get the lobule them. So that means that the cancer they can come out either at the duct, they call it ductal cancer, or you get the lobular cancer. Now, so the wall of the duct turn and we normal, and then afterwards the cell then they become abnormal first before it changed to cancer. And the way it changed to cancer, but it's still lay inside the duct. Now they call it in situ. That means it's still lay inside. Not like a boss come on inside it. Now we don't break, don't cut out. Now they call it an invasive cancer. Yeah. And then where the cells then now go inside the blood vessels there and go transported to other organs like the bone, the liver. Now they call it metastatic cancer. So that means it come out from this stage, the hyperplasia stage, to the invasive and then to the metastatic stage, and it can take a while. And we know say most times now the ducts them now the cancer the 85% that the ducts can come out and 15% now the lobules that can come out. Now unfortunately for the breast cancer, you be able for detect them early. First of all, we can always encourage people them for examining them breast. That for make them examine them breast because you sabi your breast better pass the doctor. Yeah. And when you talk about people them, I know they only talk about woman them because man themselves they get breast cancer. So we also encourage the man themselves for the touch them breast for make sure say they not feel any lump. And as you feel lump, please go to doctor because the other thing that the people they can feel lump and then they're afraid for go to doctor. It can be saying no to anything. It can be saying to cancer. It can be saying some kind of benign tumor where they can check. But if a cancer and then detect her early, then they're able to remove them and they actually save your life. And breast cancer at a certain age, you get the screening. Now Germany also from 50, we go 50, they receive get letter, and then they go for a center where they do mammography. And then if we always tell people, even young people, and say when they tell them, say when they go to a doctor one time for a year, the doctor self can touch them breast for see if they feel anymore. But as I say, very important, you sabi your breast pass your doctor, so it will better for make you they touch your breast. And how you they do that? You they use, as this picture say, they use your 3 finger them, and then you get one way where you for do you touch your breast in a circular motion. But sometimes you can move from out to your nipple, or you get the up and down method. You actually try for feel if you get any lump. You start first light, and then with light pressure, and then you increase to medium pressure, and then you go to a firm pressure where they press your breast hard for see if you feel anything deep. Especially for the one that we get big bobby them. It get nice for make you press your breast really hard for make you see. And I will also advise patients for do all 3. Some people can say no, one enough. If you just do the one up and down enough, no, do all 3. And then before you start for touch your breast, it'd be nice for when you chin up naked, watch na the mirror and see if the shape they're okay. You see if the color okay. You see also if you nipple back the color of the nipple okay, and you also see if you get some vein them, some vessels them will not be there they force them. Because you get some woman and gets thinking, gets vessels there that's okay, but you, as I say, you know how your breast stand. So when you see any changes, please go to a doctor. So when you don't feel something, you go to a doctor. Doctor self-examine you. Then doctor will decide now if I send you go for mammography. Salon back in Freetown and also then get mammography program there as well. You get some countries there with starting from the age of 14 and then they go for the screening. But as I said in Germany, 50. But if you touch something, the doctor says touch something, then it will send you go for mammography, and then the radiologist will see, okay, yes, I see some tumor there, and then you get 2 options. You get some option where you go, then you go get a biopsy. They get some kind of needle where they can use for choke that lump, and then see if then they send and go to the pathologist. I'm going to say you have to also get very good pathologists. Pathologist will tell you say yes, na tumor, na cancer, or no, na some benign thing. Some people they can say, or that some countries there when they don't get this they don't get the option for do this biopsy, they can actually just go and operate the lump and pull and come out, and then the pathologist for go check if na benign lump, na good tumor, or na malignant tumor, if na cancer. Some bobby them, it can better for make them do ultrasound. And when they do the biopsy, sometimes you can do the biopsy and you use ultrasound for guide your needle, say needle for go. And then sometimes you get MRI, some breast then they will not only MRI, they able to see tumors then because the breast then big, because the people then the younger people then breast then can thicker than older people then. So sometimes the MRI they able for detect tumor then. So this year so now the awareness for make una know the stages them of the cancer. Yeah, if the cancer they spread, now so your survival rate they reduce. Yeah, if you come to this stage 4, where it don't reach the liver, it don't reach the bone them, it don't reach some lymph node them. Then lymph node they are so like that the police station in the body. If you don't reach them place, then your survival rate don't drastically reduce to 16%. But if you detect her early, you detect her in that side where it's called that in situ, where not bust yet. Yeah, or at the earliest stage, to 98 to 100%, you'll be able to survive. So if for me, this session here on awareness, and the thing we una for know is that if una check una breast, una feel something, una please go to doctor as early as possible for make them check them. Because early detection saves lives. So, we come to cervical cancer. The one main important thing when I get from cervical cancer is that the one of the only cancer we be able to prevent. By breast cancer, you be able to detect it early. By cervical cancer, you actually able to prevent them. Yeah, so it's really, really sad for no say you get a lot of people them, especially now the low developed the underdeveloped country, developing or underdeveloped countries them, where actually a lot of women they die because of cervical cancer. Yeah, and cervical cancer is caused by this HPV, that human papilloma virus. 95% of the cases then you still get 5% we know they be caused by HPV, but 95%. And it is start first with what they call cervical dysplasia. So that means you get the normal cell again, and then the normal cell they change. Remember that first picture I show now? And then that the normal cell, the way we don't change, they begin for develop, begin for grow. And then we bust this level, this level, where it bust this level now it turn to cervical cancer. So there are also then they call them high lesions and low lesions. So there are also the dysplasia. If you able for catch the dysplasia, you treat dandy, you actually they avoid the cervical cancer. And think about it, from the dysplasia, say it reach the cancer, it take 10 to 30 years. So that means you get a space of at least 7 to 10 years for make them diagnose your dysplasia, treat you, so that you will get cancer. So it's really sad to say we still get so many deaths. 2022, over 300,000 people died of cervical cancer. And are the most common cancer in women in 25 sub-Saharan countries then, or the mainly sub-Saharan countries then. A cancer where you actually be able for prevent. So, I mean, WHO they try for well, then get a cancer and cervical cancer elimination initiative we then develop. We I find it very, very good. And we I know say Salon Safe don't implement or they try for implement. We then try for do because we they try for prevent people and forget cervical cancer. So first of all, you get for minimize the risk factors. And the one main risk factor for cervical cancer, now forget multiple sexual partners, because HPV is actually a sexual transmitted disease. And also things like smoking, alcohol can also increase your risk for get cervical cancer. The period between the dysplasia to the cervical cancer is shorter if you smoke, for instance. And as I don't say, if you're able to treat the cervical dysplasia, then you actually prevent somebody from get cervical cancer. And now, fortunately, you also get the vaccine against the human papilloma virus then. And we they don't roll out safe salon, where then they vaccinate school picking them as well. And there's also a screening program. Salon, you get some local organizations them where they do screening programs on cervical dysplasia, and for make you able to detect them early so they able to treat them for make women they don't forget cancer. The program still not go all around the country yet, but with the hope say in the near future through awareness, through TV program, radio programs, them people then will get more aware and we go able to eliminate cervical cancer. So these are the targets of WHO. They say by 2030, therefore we for able for vaccinate 90% of girl picking them. Me the hope say we also vaccinate the boy picking them, because if you vaccinate the boy picking them as well, then they're not going to transmit the disease or the viruses to the girl picking them. But first now, the main goal, first of all, for vaccinate 90% of girl picking them, and screening programs them, therefore develop in such a way that 70% of people, of women them, to be screened. Germany also first them they start at 30 years, but now they don't talk say any woman where they try and forget picking, even if younger than 30, so therefore go through that screening day, and then say up to 90% of women there will get cervical cancer for be treated. Or not only cervical cancer, cervical disease. That means if you get the dysplasia as well. If you get the dysplasia, you aim for treat that dysplasia there, then you get cancer. So when I get for understanding it back, you get the dysplasia, something the word, it go difficult for people to know. But that means say the cell don't begin, don't change, but not to cancer yet. Because you get some people then go to doctor and go do some screening and tell and say, oh, you get dysplasia, you don't afraid to get cancer. No, you don't get cancer yet. A good say they don't find that dysplasia day, and then treat that dysplasia day, then you actually they prevent you from getting cancer.
Right. So when it comes to prostate, I think we don't talk about this one. This is not just an overview. Renal prostate nada chestnut size organ with the under the bladder. Now they the bladder in, the pipe, the wee pipe. Now they pass, and the pipe also we get the sperm and everything. And then it can mix them before they go out. So that organ there, now it can make people and get cancer, mostly man them. Now, we don't talk about the things that they cause cancer. Now, some things and you know ever prevent her, right? For instance, the statistics and studies show we say out of every 4 black man, 1 of them will get cancer. So if we're in this room, you get 4 black men there, 1 panel, the chance of getting cancer is high. And this is not the most common cancer, after lung cancer for man them. It can actually cure them if you get them and then catch them early. Nearly all the people that we then catch the cancer early, they survive for 5 years or even more. Then the way they catch the cancer late, then chances of surviving for 5 years will be like 50-50. Now, some things that really cause this cancer, going to change, as I say earlier on. Things like age, we don't talk about her. 75 to 90 years, the chances they high because of age. There's nothing you can do anything about it. And you ethnicity. If you're not black person, you get the chance. 6 black man get the highest chance past every other race, next to the Caucasians then. So any black man is 45 years and above, he get for be aware of this. And he get for take note of this so that he go able, avoid in doctors them. Because black people okay avoid doctors them until when you get symptoms. So this not the kind cancer where they wait till you get symptoms first. You get for the go check. And when you get the symptoms, you get for not delay, go straight away. And people then if you get your person where get cancer, now the family when prostate cancer, and that person in less than 60 years, the chance for you get them a high. Not to your fault, not to nothing, because of your family link. And some people in the family they get certain faulty gene, like that block they already talk about, the block then at the house. Waiting to make that block they go faulty. You get the gene inside there. Now in the control how that block they go for even form the organs then at your body. So some people in there, the formation of that gene there is faulty. Mainly people who get BRCA1 and BRCA2. And then in there, they get risk for the other cancers in back, like breast cancer as well, and even and pancreatic cancers. Now, when you get you notice something, first, if this now one of the cancer, I need to make this known that this now one of the cancer where they not get an established screening program for. Why is it so? for reasons we don't talk before. And if at all they get for do a screening program, this blood test, what they call prostate specific antigen, prostatic specific antigen, now normally they will get for use. But they no go use this because this is not reliable, not a reliable test. However, they give a guide to waiting they happen with the prostate. So the doctor, if you concerned about that, you're over 45, you go meet the doctor, you say just one check. You know, I will really encourage every man, black man, or even white person, Caucasian, over 50, black man over 45, they go do them test, then they elect now once in a year. Then they take the trend of and see. The doctor will examine you, he will try for feel that prostate and see if that prostate they fine. If it's not fine, it will lead to do other things like scan and biopsy and everything. Now, the key person for diagnose this thing there, now mostly the pathologist, then we're able to go determine now, say this cancer we get, so na cancer we spread fast, or na cancer we not get for bother you early, then you and the clinician now una determine which kind of treatment you get. Now, the treatment they in different group, it's different for prostate cancer because we know some people will get prostate cancer, it will get them for years, and it cause no problem, to be honest. So then people in they know they go straight away rush into GAN treatment. Why is it so? The treatment itself gets immune problem, immune side effect. It make your life become miserable. They lost you manhood and other things and they happen, you know, to you. So they know they go straight away. Then get what they call active surveillance. That every 6 months, every 1 year, then they go do all anything we don't talk so. The blood test, the examination. If they notice any changes, then straight away they send you. Then they don't like for wait for put you per active treatment. Then you get the one way it no say this wire actually the cancer don't spread now. You know, what will they do? Lord just they watch and wait. If it reached stage now where we know say we'll get for do treatment, weigh the benefits, the benefits of doing the treatment, if it outweigh the risk of doing the treatment, then they go do them. Or some man can decide say I don't want to do nothing. You see, so but this now an arrangement where you they make with you and the clinician where they treat the cancer before they go into all the other management there, treatments there what we don't talk before. No go to again because we don't talk about them. Now, the next cancer, we is very common. Of course, the most common for man, and the second most after breast for women. Now, lung cancer. Within a lung na that organ with the inside your chest bone. It dey inside, then call and say you fuck with the inside. The windpipe where they breathe by, na in they go inside your lung and everything. Through the windpipe, it goes so that the air where they breathe will exchange and everything. So thinking this it get high risk chance for get cancer day, right? And the thing that they cause cancer na the lung, I want to emphasize and say them boku, not to just one thing. And the most common thing where they cause the cancer for the lung na smoking, right? However, smoking not the only thing where they cause cancer. Somebody they will know one day smoke na in life, it they get cancer, lung cancer. Due to so many other reasons. It can be due to in work way they do, air pollution. It can be due to passive smoking. So they need smoke, but it deal with somebody where they smoke, if they go na poda or keke, where the keke man na smoker man. That smoke the way they do the carcinogen, nicotine, they na the air for some tell you inhale them, small. Even worse past the way they smoke safe. And some man they take shish or whatever it is. So you get so many things that will cause Nande, and some lung condition the back where you get can predispose you for get lung cancer, right? And even some studies they show say even the hormone replacement therapy, there are some of them can lead to lung cancer. So not to just only smoking they cause lung cancer. Now, mostly where people get lung cancer, they need to get no symptoms at all. And the early stage, which is why we be done the hammer home from the start, say try let them catch an early, do all the screening and everything. As I mentioned earlier on, we not get an established screening or most countries then, but then they try for introduce them. So certain people when they smoke, then they introduce them for letting they do scans and then things so that they go catch her early. But most people most of the symptoms and signs them way the lung it came from your breathing or from your lung, it happen by other condition them. So now make it difficult for let them bring and come together, say, okay, this person straight away get one symptom, they say get cancer. No. So here in the UK, then group the symptoms them where somebody they get, and the person in age, then determine, say if you get them symptoms there, then for send you so that they will investigate you. What are these symptoms? If somebody they cough, we know say this now cold term, now harmattan term, people in the cough, boku. But the cough they more than 3 weeks. Eh? If they get boku chest infection, if they lose weight no more, if they eat, but just they lose weight, you know, they know it in the cause. You need to do exercise for lose weight, but just they lose weight. Or you cough blood. And you they lost appetite, you they feel tired no more, you work as small, you go do something, you don't feel breathless. You they feel pain then, you bone, your shoulder, you they sweat na net. These are all na symptoms of lung cancer. However, they can happen na other condition. That I need for AMA home down they happen other condition. So how we they do an when the patients then come to we, if they say the person will look at age and we look the symptoms that we get and how long you get the symptoms and then we say, okay, well, this you get this wire, you don't cough blood. We try for know why you cough this cough blood. If you not get any explanation, we send and for let the person go do investigation. Sometimes you need the first investigation as X-ray. You go na A&E. Sometimes some man they go for different, you know, when if you say na cold no more, then go na A&E. The A&E, the emergency specialist there, then they get access to investigations then. Then can do the X-ray. If they do the X-ray, they notice any small thing there, then they send you for let go do scan. And then can forward and straight away, then can go na the cancer department, lung cancer department, let them go treat you. Now, if somebody gets any of them symptoms I mentioned, then you don't ever smoke. Like now one of them, then they send them. Or if you don't ever smoke, you get 2 of them symptoms, then they would send them. So now so we try for evaluate cancer people naya. And when you get the, when insinuating in the do, when you see the doctor, they examine you, they do the investigation there. Mostly in X-ray, scans them and all them thing and then they try for determine who side this cancer are. Now the cancer can be say na the lung self na they come out. Okay. And you get another cancer, we know to the lung it come out. So then people really say, I no smoke but I get cancer. It can don't get cancer from other parts of your body, we spread can the lung. So they call it secondary cancer. And of the cancer they already start na the lung. You get 2 main types. The most common one, where about if you take 100 people, 80 to 85 of them, then get them. If you get 100 cancer people, 80 to 85 of them, they can get that cancer. They call a non-small cell lung cancer, and the most common one. Now, this cancer, although not the most common one, good thing about them, it not they spread fast. Is they grow very slowly. So if you act fast, they can even able to treat them and clear them for you. Now, the cancer way in Noboku, if you get 100 people who get cancer, maybe 10 or 15 of them will get that kind of cancer there. Then they in small, but it's dangerous. They call it small cell lung cancer. I small, so it's dangerous. It is spread fast and it cause problem. So now the treatments that they within the give will be done highlight about them, about the operation, the chemotherapy, radiotherapy, and now the new treatment they don't get and they try for boost your immune system for fight against the cancer and sell them, you know, so that they're able for destroy them. Now, most of them cancers there, we don't talk about them. Breast cancer, cervical, and prostate cancer. You can go now with YouTube video, you watch them cancers and they in detail. The one where we not talk about it now the lung cancer. If people willing, we will talk about that at some stage. So, I mean, the take-home message now this one, the cancer is spread fast, and they go, you know, it is spread very uncontrollable, you know, and it get abnormal cells that when they develop, then they go beyond them and boundaries them, then it can spread go on the other side, you know, more than about 20 million new cases of cancer, you know, and they detect by year, and 9.7 million people then die of cancer. See, so up to half of the cancer there, where people in the die of, they can prevent them if they avoid that risk factor will be the talk about earlier on. If you avoid them, you know, because the risk factors them now the two they lead to the cancer. You get what they call avoidable and non-avoidable one. The one where you able to avoid, if you avoid them, you know they get that kind of cancer day, you know. And if they diagnose and treat early, they able to live a longer life.
Yeah. So we thank you for attention. If you get any questions, then now is the right time for ask the questions. Then.
Questions, contributions, or anything.
Yeah.
Thank you very much, Dr. Bell and Dr. Turay. Plenty, thank you. Dr. Bell and Dr. Turay make some references. So I don't put the link for the breast cancer at the chat. And I also don't put the cervical cancer link as well at the chat. Yes, Anne, I will go to you. Hold on for me, Anne. Let me find where you are. There you are.
You probably unmute everybody. That this is. If you just unmute.
I can't unmute you. I don't know why. They tried it.
Okay.
There you
Can you
go.
hear me now, John?
Yes, I can. Welcome. How are you?
I'm fine, thank you. This, what I'm going to say is for Dr. Bell and Dr. Turay. I had a very good friend who had lung cancer. She had an operation and then she went on chemo. It did affect her mental health. And then not long ago, she got leukemia. So she had radiotherapy for a month, for a solid month, every day for a solid month. It did affect her mental health so much, but touch wood, she's cured now, which is good. But it does affect your mental health because obviously it's the stress and obviously the treatment that the patient's receiving. I go every 3 years to have my mammogram, and I do, you know, kind of suggest that people do go. Don't be frightened. It's painful, but it's worth it because then at the end of it, you know you're all right. And they catch it early. So thank you, Dr. Bell, and thank you, Dr. Turay. That's been brilliant. Thank you so much.
Thank you so much, and for
You're
your
welcome.
contribution. We really do
Yeah.
appreciate that. We hope people will listen and adhere to that. Yeah, this what we were saying. Some of these treatments, they have their own side effects, their own complications. You know, which is why they don't initiate that immediately. It depends on the stage of the cancer. If the stage probably is early, they may not have the aggressive, you know, treatment that might affect them. It doesn't only affect the individual; it affects the family as well.
Yes.
And the people around them. You know, it's a lot. It's a journey, really. That's so much difficult for the person and the family looking after that person.
Yeah, it is, and obviously they caught it in time. But I think the radiotherapy every day for a month, it just made her really poorly.
Oh yeah, yeah.
Obviously, at the end of it, you know, she was still poorly. It took her a bit, you know, to get better. But
yeah.
like she said, the good news was they caught both of them in time.
Good.
And, you know, she'd had the right treatment.
Yeah.
you know, and she's a very good friend of mine. I was in hospital with her when I had COVID.
Mm-hmm.
So, you know, we've stayed friends ever since then.
Yeah.
You know, so I just did one of them. I don't know whether you know the diamond paintings.
Mm.
Well, I did a big owl and I framed it and everything. And I says to her, we met up and we had a meal.
Okay.
And, you know, to bring her spirits up. And I gave her this and I said, you've gone through so much.
Mm-hmm.
You know, this is just to give you some support, some help, and make you feel better after all gone through.
Yeah, that's really good of you to do. You know, it elevates her spirit. You know, really appreciative that people around that can help. I mean, say in the case of palliative care, that's all what people do. You know, elevate the spirits of the person and then try to improve the symptoms that probably they might be having that would affect their, you know, their life. You know, now she was bold enough to start go for the investigation and then the treatment, and now she's, you know, have a better life. You know, you know, that prolong a lifespan rather than living it till it's too late. You know, some people are scared to even, you know, and disclose their symptoms to their doctors, you know, and clinicians. See, so that's really good. That's really good.
And also, when I worked in the hospital, on the ward I worked, there was a gentleman, and he was on end of life care, and he wanted to go home to pass away, and the doctor refused.
Oh.
I fought for this man because he really wanted to go home to be with his family. And I went through all the channels, and within half an hour, he was going home.
So what was the reason why the doctor refused? Because it doesn't.
I don't know. He just said no. He's staying here.
No, but that's the patient's autonomy.
Exactly.
Right? The patient's autonomy to choose what they want, as long as and he or she has capacity.
Yeah.
Is that right? I mean, that's unheard of, really. It's surprising to hear. I'm surprised to hear that.
Yeah, he just said no, he's not going home. So I went to people I knew higher up ranks, and I just sat there and said, this man has to go home. His wish is he wants to go home and pass away with his family. And obviously within half an hour of me running around and getting all the he went home.
That's good. That's good. That's a good support. That's good help you've done for that.
Yeah, because at the end of the day, if that's their wish, and somebody
you have to respect their
wants
wish.
to stop them from going home, that's breaking their wish.
Yeah, it would have been difficult
rights as well. Yeah,
it would have been difficult if that individual got no capacity. And it will be in his or own best interest. But in this case, he's got capacity. I don't know if he has got advanced care plan. You know, if not, then the lasting power of attorney will make that decision for that person.
No, everything was in place, Dr. Turay.
Oh, really?
Yeah. So, you know.
It's just one of those
I think it most probably was a doctor that didn't really understand how can I put
it? Ethical principles. Probably it didn't.
Yeah. But that gentleman went home and he passed away with his family, and I saw his wife and she threw her arms around me and she said, thank you so much for fighting for him. I said, no. I said, your husband wanted to go home and I wanted to fight for him.
That's good. That's good. Thank you, Anne.
Thank you.
Somebody wants to ask a question. I think Anna Nicole or something.
Yeah, Hannah Nicole. Has she dropped off?
Oh, yeah, there. I tell you, I'm still there.
I'm here. I'm still here, Anne.
No, is it you as well?
No, there's somebody called Anna.
Yeah, there was somebody's hand on.
It's okay. We can continue the discussion.
Oh, there. I don't know if she's still. Hannah.
Yeah, I was trying to unmute, but you guys refused to unmute me. Anyway,
sorry.
My question is, does the perimenopause or menopausal period predispose you to have tumors, either benign or malignant?
What's the question again? The menopause, what do you mean? The menopause treatment or the... No,
the menopausal period.
Okay,
because people can have lumpy breasts, some can be benign, some malignant. Does it predispose women to have tumors, breast tumors?
The menopause, not actually the menopause, as not turn to Krio because Krio session. The thing we've been not talking about the age. Age can cause it can be one of the risk factors that we make people or make women then get tumor as well. And we come back to breast cancer, for instance, as well. But at different, even benign tumors, them at different age, you get young beginners where they get benign tumors. Them, but at the end of the day, because of the age, because of the repair mechanism where they missing, where they slow down, they make people them at higher age, an older age, and they get a higher risk forget cancer. So not I will say the menopause of itself. Because on the other hand, you get when it comes to the breast cancer, you get receptor positive and receptor negative breast cancers, and when somebody they go to the menopause, you actually hormones and they decrease. So because the hormones they decrease, it can that's one of the reasons why people get the breast cancer. But because of your age, it make you prone forget breast cancer.
Anna, did I answer your question?
No, okay, I think mute. I think what you can add to that is that if somebody they're on hormone treatment, like how Dr. Bell said, the age, the imbalance between the estrogen, progesterone, and then after a certain age. So if some people they take hormone treatment, some studies shows, it's debatable, some studies say it predisposed to breast cancer and all, and some studies say no, in a coincidence. So it's debatable, really, but because of the excessive predisposition to the estrogen and progesterone, sometimes even the womb self it can affected. We not get protection for the progesterone, you can get even womb cancer. So after we reach menopause, it gets screening, the breast screening program, and they like in the UK here, they like from 50 to 74 years old. After that age, you can opt for doing for yourself. You see, same as bowel in the up to 50 to 70. You see, so age play a role, and age come with the hormone imbalance, hormone changes, and all the other things same as well. Same as prostate as well. As you grow old, the age, and it's more common with Black people, and because high testosterone and all the rest. That's what in some studies and they say. You see.
Okay, so Hannah, you're on mute now.
That answers the question, because I think it's the age, because the particular question I'm asking is somebody between the 45 to 55 age brackets, which is perimenopausal into menopausal period. Yeah. Okay. Thank you.
Thank you very much. Doc, I want to ask, read something say breastfeeding. I don't know if Dr. Bell, I don't know if your previous session we don't talk on them, or even if you talk about them today. I think the previous section you did, the one we don't do on breast cancer. But what I answer is breastfeeding, does it it reduce breast cancer because that's where like that I don't read. It say it will reduce for women them, but also it will help the risk of as well to the picking. Is that true? Elaborate on that, please.
Breastfeeding, then can say breastfeeding can reduce the risk of having breast cancer. But I don't know if you talk about the picking. I know.
It say breastfeeding can reduce the risk of cancer for both the mother and the baby.
Okay, that's new to me concerning the baby. But for the mother, I know say definitely they reduce the risk of having breast cancer. But you also get, I don't know if for the picking, honestly speaking, I don't know that's new to me. For say when the picking grow older, then the risk for making him get breast cancer low because he breastfeed, because the mama breastfeed.
You like this one?
Okay.
Okay. No, that's new to me. I don't know. But for they always encourage women for breastfeed because yes, then they can reduce the risk of having breast cancer.
Okay. Another question I want to ask. I'm sure I know the answer, but I will just clarify things for people as well. Is that and also we talk about preventables and stuff. Any cancer day you go see 100% preventable.
Yeah, cervical cancer. Cervical cancer. Then they definitely. I don't talk about because I don't do a session on I talk about them back today because the one cancer then they where you actually the able for prevent. We talk about the risk factors then where they talk about the reducing the risk of having cancer to 50% if you avoid some risk factors then. But when it comes to the cervical cancer, definitely if they find the dysplasia, they find that the cell changes will not occur already, they find that they remove that you actually they prevent cervical cancer. So Namion what that they for all women them for make them they go regular. First of all, if you get the possibility for get the vaccine, the HPV vaccine, I will also they say the program the way they mostly for picking them, but some women them some older women if then the HPV negative, they can go take the vaccine if they want for. Some studies they also show that even if you don't HPV positive, you take cancer, it can also help you. But for WHO they say picking them where they go school, we don't reach 14, 15, it will nice for make them be vaccinated. And as I also don't say for prevent for they get multiple sexual partners, that is also a risk factor for try to avoid. But as I say, very, very important for the go to doctor regularly for make and check and see you get the dysplasia because now you actually check for see if you get the HPV. You get tests for see because sometimes you don't get the dysplasia, but you get HPV. And if you get the HPV, then you get some places then they wait and say, okay, for go every 6 months, some places say 1 year do. Because if you get if you get the HPV until they get the dysplasia, until they get the cervical cancer, it can take up to 10 to 30 years before they get the cervical cancer. So if you see somebody we get cervical cancer, that person they most likely don't get HPV or the dysplasia 10 years earlier. Where if you don't see doctor inside that 10-year day, then for not avoid and forget the cervical cancer.
Somebody don't ask a question. Is it true that women giving regular? Okay, let's just read them. Let's try to read them in Krio as well. Is it true that women giving regular breast to adults also? DK. Okay. DK man, thank you for your question. Doctors, is it true that women giving regular breast to adults also help reduce breast cancer?
No. No. you get for, I mean, that's the sexual way we can't people they do, so it's not any bad thing. But I can always remember this story. My daddy's a gynecologist. He gets one story where me tell me where it's say okay, that they begin for do with infertility. Woman they come, they say, oh, you don't get picking, they try to get picking again, you never forget picking, and they find out say get one hormone at the body way really high. Where anyone that say what you just pick as almost you pick you always say pick on 4, on 5. And say, well, but this woman is really high. I mean, still a breastfeed you picking. Now I say, no, I need to breastfeed you picking anymore. It's about my man can suck by the breast. So doing that, the woman know they actually see period regularly, and if you need to see period regularly, you know, get for born picking again, because it depends on how often you breastfeed. But if you in a breastfeeding stage, usually you know they see period, and through that, you know they be fertile. But I mean, if the woman know they produce no milk and the man they suck on the breast, and that they know they prevent, you know, they reduce in breast cancer risk.
Okay. I see how I say if they produce oxytocin.
Yeah.
Anyways, this
prolactin. Oxytocin and all the hormones then they.
I think say big man I think say the flyaway they refer to, I think say himself we don't see him. They can normally begin to the rounds around the breast cancer promotion month, where they can, you know, there's a flyer. I think I understand the flyer you talk about, where they encourage people then for play with their breast for their, you know, if anything they able seek help.
Yeah. That's and honestly speaking, it's not, that's a good thing. Where people we get for people go for encouragement. I mean, honestly speaking, if you get a partner and the partner like for play with the breast, sometimes the partner can even know the breast more than the doctor. You know, and then if the partner feels something at the breast, and say, "Oh, this year, so no." It's honestly, it's something very.
No, worry.
If the partner able to feel the breast and the partner feel a lump on the breast, then the partner can tell and say, that lump day 3 weeks ago, you know, me there now. You know, no, it's very important. And even in Germany as well, it's interesting. For reduce the cost, we get that Germany has like gynecologists and they deal with breast, not so surgeons, but gynecologists and deal with breast. So that some of the gynecologists that practice, then they get blind people then. They get blind people then when they touch the breast. You know, because their sense is really good. You get a program there now where actually they employ blind people then. So now one of the creating jobs. And then they feel the breast and see if then they feel any lump or not, and that's just a good thing, you know. So touching the breast, you yourself touching your breast regularly, your partner they touch your breast regularly. It's not a bad thing. It's encouraging. Honestly, it's encouraging. I would also like.
So big man, me and you on the same side. We don't get small encouragement as to why we for the oblige. But also, I know say you're not blind, so there's no job on that side for you for like go begin do examination. Brian must say, what is the strongest predictor for prostate cancer? Brian Bangura.
Predict.
Yeah. Say for example, I guess maybe what they say is are you able to know on your own without even going to doctor? I guess. Maybe that's what they ask. Brian, if you ask the question directly, that's fine. But I think say that you mean. If I don't misquote or misrepresent you, please or ask me for unmute you. Then I go unmute you and ask for yourself. But I think say they ask say how you able to know without going to doctor. How you able to know say you get prostate or you get the symptoms of how you able.
Yeah, that's difficult because the prostate gets symptoms always similar to Boko that thing there. you know. So like you want pee, they get problem where you want for pee, you pee blood. Somebody over 40 years, they get blood now in semen, you know, and you want for you get back pain, you know, back pain. Back pain, they tell you say the cancer don't spread go na the bone.
Boom. Yeah.
So those are the late signs, you know. But the early stage, make sure say, you know, after 45 you do the blood test. Then the earliest the way they check you, where the doctor check you back passage, they feel the prostate incisive. They feel them because the prostate get three different conditions that go happen. It can either be say cancer, it can either be say a benign something when a harmless swelling, and it can either be say infection or inflammation. So and all in three then they can get similar, you know, presentation there. You see. So I make you know they mostly know, except something we don't spread now. You don't go na the bone, you go na the back, you begin get bad back pain, you know, you begin pee when a blood, you know, and all anything in there. So I make the early stage basically now for do the test, to be honest. And that PSA test to they talk about no be elaborate on them. But it not reliable, but it give a guide. Why it not reliable? Because the prostate incisive they produce that chemical day. Waiting they make it produce. If you get sexual intercourse, it a producer. Okay, if you get water infection, it produce that chemical day. And if you don't like you ride bicycle, you don't feel vigorous thing on top the prostate, you sit by the bicycle they do, it a producer. So if a producer high, you know, it depend the doctor who you meet. You know, for panic enough, say this wire is straight to get prostate problem, a need for repeat them. And when would they send 10 patients if do that test day? Would they tell them say one no get sex 2 days before, no vigorous exercise? Then if you don't deal like water infection, you know, they postpone it for 1 month, you know. So then a one indicator then day we go really then the doctor examination plus the other symptoms that we they get.
Okay. Yeah. Anybody else want to add something? Okay, I'm just conscious of time. We don't pass half past. On time now for the we round up. So I go through the panel for there. I will see the one the video online, and I'm not thinking that everybody online today, but I'll go through the panel. The family on a plenty, thank you, but they will stay a little bit longer. Let the panel give you now the final word. Dr. Ansel Samu, I've been seeing you before.
Yeah, indeed.
Good afternoon, everyone, and thank you very much, Dr. Bell and Dr. Turay, for such an educative presentation. The family on I don't hear the word, the expert they don't talk. We just want for encouraging that for the cancer the way involves screening, they are at the big. When I make sure so when I go ahead and screen. I just want to share my experience with you. I think it was in 2022. Now in the US, then they encourage me for do the mammogram every year. So when I do and say, oh, then see something, I go get for repeat anyway, me not take it serious. And I not get history. I know say I get history of breast cancer in my family. I don't. But I mean, get a very close friend will die from breast cancer. Then I think I had it towards the end of the year. Then early, I think 1 month or 2 months later, I still not go check, then send a reminder. So I guess the more than they remind me, I begin freak out. Imagine, me when a medical professional, the public health expert for that matter, we suppose for, stay on top of preventive care. Anyway, I finally gave them out, I go. So they don't want me to say if they go, they're not still satisfied and they do an ultrasound. Anyway, as God would have it, when I go, then say this particular area where then they focus on, then still not satisfied. So we'll go for do the ultrasound. Man, I begin freak out. In fact, all of a sudden I just begin think, but this me paddy. By the next thing you don't know, I begin cry. So the technician kind side, now he say, why you they freak out? Why you they cry? You they do the right thing. You there,
And it not mean say because we say for go do this ultrasound, that means say you get them. But then it calmed me down. Very nice lady able to talk to me, calm me down. That's what I know me want do them. We go ahead, we do them. So when we do them, then say make her wait, let the doctor review them. When I dey wait, all kind of thoughts don't go through my mind. I begin to say to myself, well, Angie, if you get this thing, what you go do? So I say I go record my journey, and then I go actually, because for a long time I did think for do something on social media. I say, in fact, this night go even be the motivating factor. I say I go record my journey and then use them for motivate others. Then after I don't talk all that day, I don't calm myself down. In fact, I cry back one Florrie. I just hear this inner voice, they talk to me. You know, to God in picking, why you the pull close with it, not meet you it? Come on now, chill. Just take a chill pill, wait, let the cab give you the results. Then we could take out from there. Luckily, as God would have it, the results come, they say all seem fine. But of course, they remind me, I think I do again for Duam, because I can do them towards the end of the year. Come mid-December annual checkup, I for still go for Duam. But I just want to use this opportunity for encourage others, it better follow than you don't know. All my case will be different. Me, lucky, they're not for nothing. But as Dr. Bell say, when you get a higher success rate when they diagnose them earlier. So please encourage others. In fact, I get beaucoup padid in a salon, we can really they freak out. I can always they remind them and they beg them and encourage them for go. So on a load to encourage we loved ones them. Any of the cancer that we get a preventive screening, let we go ahead and do them. And let not forget for the check with breast, as they already state, both man and woman as well. My family, thank you for wanna join. Without this not will be possible. Not forget well body, a better pass gently. Over.
Thank you very much, Dr. Angela. As soon as see, everybody, we all human. It perfectly okay for let you freed. It perfectly okay for let you anxious. You're right. The other day, somebody did ask me, say, I did apply for a job, I've been getting an interview, and somebody, I don't say this not to bless stuff, but it just shows no more. They say, you don't think that you failed. Interview not to anything for you. But I tell them, say, even when I can start a new job, something that I can anxious. So it's perfectly okay for let you anxious. It's perfectly okay for let you feel a bit nervous. And most we can do something for do with health. It's okay. But the only thing is try forget, in Dr. Angela in case, it's on to God. That they use as in comfort. You might get you confident, somebody when you party, where you trust, or you might get your partner. Whatever you able to use for calm yourself down, use their avenues then they for get yourself, in that state. But the way say it always better for let you know than you don't know. Then maybe something we for be curable, we for be easily sorted out, but because of fear, you don't left until you get to a stage, and by the time you find out it is a stage now where you can't do anything about it. All right. Thank you very much, Dr. Angela. And Dr. Rashid?
Pamulda, una good evening. Una thank you for come and listen to this wonderful presentation. Dr. Bell and Dr. Turay, una thank you for the good work. Now, one small thing I just want to add. Dr. Bell say, make we dey go to a doctor regularly. Fumble them. If you forget anything, just remember that. Because they also tell we say, cancer, if they know about them at the early stage, then can able to do something. But when Gary don't pass water, then magic no day. One part the notorious cancer, the way where then diagnose na few months to 1 year at most, they kill you. Now in a pancreatic cancer. The reason for this is because, as the doctor then don't say, this cancer not get symptoms. So most of the time, now the late stage then can diagnose her. and self wetin can make them know this na cancer where leg for spread to the liver and the membrane will cover the belly, where they call peritoneum. And where you reach that side and they know they take, they carry you go. So farm with them, do ya una member say, well, body better pass gentry. Una leg for go to doctor. I like you know they sick self. For just general checkup, you never know.
Dr. Rashid, don't mute.
Okay.
I think you done. I think.
Okay. If I'm with them, like on I Dr. Rashid say, I'll just give a little bit on that as well. Not to say we they advocate for make doctors and get work. No. Not to I don't try for advocate. But basically, all this money will they work.
Sorry, family.
You don't mute back. Yeah, you don't mute. All the money will they work, all this hustling and bustling way will they do. For bill O's, buy the nicest car, buy the latest designer. Trust me. First, you always eat to like the can go. But all thing, if you not get well body, you know they enjoy. I get a short video I posted on my status yesterday.
Better pass gentry. Thank you.
Thank you very much, sir. A lot of people comment on. It say if I give you 1 million, you go take them. Say yes, I go take them. Then they ask some young people and they say, okay, what about if I give you 10 million, but you die? The person say, no, in a take, I like you give me 100 million. Then they for sure you say you well body health.
I know they are nobody.
Your health is more important. It worth more than any amount of money, any amount of gold or diamond you get. Okay. So now Dr. Rashid try for terrorists. So Auntie Nafi, not try for making short, not try for round up, please. Nafi.
Good evening, everybody. First of all, I want to say thank you to Dr. Bell and Dr. Turay for the great presentation, really informative. And I want to thank you to everybody who don't spare the time for joining. The only thing I go add now for echo waiting Dr. Angela and Dr. Rashid don't talk about early detection. As Dr. Bell say, you know your body better than the doctor. So when you detect something at the breast, you generally not feel well, you're supposed to seek early help. So the earlier than diagnosed cancer, the better and the quicker it could be. Tina, that number there for that. Thank you, everybody.
Thank you very much, Auntie Nafi. Auntie Gugi. Auntie Gugi. Oh. Auntie Gugi. No. Yes.
Good evening, everybody, and thank you, Dr. Bell and Dr. Turay. I'm not gonna too much for add now because just for confirm with LT with your man don't talk for say early detection and talk something about the mental health part of where somebody then they diagnose them or it gets that I will call them that concern about the cancer, because sometimes psychologically anybody with a diagnosis with any sick, it go just forget that mental health issue, that anxiety, depression, stress, and everything. So get for be very, very careful, get for take that into account for any time where then thing and they come up. So the most important thing is that support where that person they need, because now very, very stressful time for just not the person, but for the family and friends and everybody. So therefore think about the mental health part of it as well, because if they're not support them on that side, something on that side, that area then will cause a lot more problem for them than even the diagnosis. So therefore think about the mental health part of it as well.
Thank you very, very much. Now just echoing exactly within Dr. Angela been saying when I tell you they can't hear. Yeah. It can be very difficult from a psychological or mental perspective for let you cope. It just take a bad news away. Maybe your partner where you don't love so much decide for left you for whatever reason, or you lost your job. How you feel? Imagine that they compare that to a medical stuff where you feel say most likely maybe they tell you say you only get 6 months or 1 year for leave, or they will tell you no more say there's a suspect, say something might go wrong. How you feel? So there, if somebody come and tell you what anything they do with the big say, and try for daily for that person, then try for not making life difficult by spreading them to sign off for go. Instead, give that person the support we need. Okay. Auntie Fabata, Mrs. Kama.
Yes, good evening, everybody. Now thank you for for joining me this evening. Thank you, Dr. Bell, Dr. Turay, for really well put together presentation. We cover a lot of things then. I learned a lot. Waiting, I just want to add, I think, not general knowledge actually, because a lot of we were within healthcare, most of we careless about, health and well-being. So I encourage we all for take that step for, go for them, checks them, especially who don't pass 50. All them screening, now for check if you feel anything, please see your doctor. So thank you for the wonderful presentation.
Thank you very much, Mrs. Kama. Dr. Kama, if you still there with me, I'm not sure. Dr. Kama? Okay.
No, not this
All right, I'll
put.
No, he did it.
Patient.
Yes.
Yeah, but maybe busy. Okay, Dr. Bell, you go first, then Dr. Turay will go second, please.
Yeah, I just want to tell all thank you for who join. Another year the message. Early detection saves lives, and please, Angela and others don't talk about the mental side of this thing, because people that you go afraid, anybody go afraid, me self and me go afraid, and so that fear now will make we no one go to doctor, and then they can even and this if I be no, let them not come out, because if we decide or we're afraid for go to doctor, and then 5 years pass, 10 years pass, and they say if I be no, then I go bad, So please, when I watch on ourself, now go regularly for the one they say for screen, go regularly for screening, and take good care of yourself. Avoid risk factors, smoking, excessive alcohol. Avoid the risk factors. Then we pray God say we go help before go through. Because my body better pass gentle.
Thank you very much, Dr. Bell. Dr. Turay?
My family, I thank you for joining me tonight. Una don't really do well without this program no go ahead. Now we do one for they don't talk all the thing for talk and no need for add to again. I'm sure we know say well body really now more important. And for lay you go get continue forget well body, go meet your doctor, no go meet the real person. That can say meet the real person. Then you tell her you concerned. That small money where they pull for do that test, it will save you tomorrow, you and your family. So that small money, they say you can stone money for make money. So stone money by your health so that you get better health for let you continue your life, you can make more money. So well body, better pass gently. Thank you.
Thank you very much, Dr. The family have plenty thank you. I see Elizabeth and up. Unfortunately, we don't done now. We don't done that side. I will just take this opportunity for wish everybody happy festivities, and we wish you now a bright and prosperous new year. We're not going for present again this year, but by God power, we'll go see everybody well and healthy next year. Till we meet again, well, body, it better pass gently. Good night.
Okay.
Good night.
Good night. This pool here.